So when I was 15, I think, yeah, 15, around the spring, summer, when I was 15 is when some of the symptoms started happening. And obviously they didn't know I had Crohn's disease at that point. The very first symptom actually was in my mouth. And now I'm a dental hygienist, so I watch for those things. A lot of diseases, the first symptoms show up in the mouth. And so I had sores all in my mouth, all down my throat, and they had no idea what it was. It was crazy. So I was actually at girls' camp at the time. And it was, I think it was in June or something, in girls' camp. And I had to go home because like my throat was swollen, my mouth, I couldn't eat, it was miserable. And it was the weirdest thing. And so I went home, and my general primary physician sent me to, and I believe it was an oral surgeon? I'm not really sure. Just to try and diagnose what it was, because it was a mystery to him. And they diagnosed it as some weird, I don't even remember what they called it. It was some weird thing that happened commonly in Caucasian, blonde, blue-eyed people. It was the weirdest thing, and it was really rare. And they were like, oh yeah, it's fine. And it ended up actually being a symptom of Crohn's disease. So later on I found that out. But lots of times it goes undiagnosed for a long time. So progressively, this diarrhea started happening more and more, many times a day. Being depressed was another one that started happening. And so my mom took me to a psychologist, thought I was, having issues. And they thought I was all kind of just in my head. The pain and my sickness, they thought it was kind of just in my head. That happens a lot because, they don't really know what's wrong. And then eventually my stomach symptoms got so bad and I was in a lot of pain that I went to a gastroenterologist. And he is the one who did, what they do to diagnose things is they do a scope. They do it from the top or from the bottom or both. They did both for me with teeny little cameras that go down into your digestive system and look around and see what's going on. And they can also take biopsies of certain areas that they would like to biopsy. So they did, and they biopsied, and the doctor actually told my mom he thought I had leukemia because of what he saw during the scope. It was so bad. He thought I had cancer. And so that was probably not the smartest thing to say to a mom. She was freaking out. Unless you're sure, of course. He wasn't sure, so he probably shouldn't have said it. But so she drove me home, and I was loopy from the colonoscopy, and she just obviously didn't tell me anything until the results came, and the results came from the biopsy, and it was Crohn's. And so that's finally when I was diagnosed. It was about not quite a year later, but almost a year later. So basically, things were just getting worse and worse and worse. I was at a pretty bad point once they diagnosed me with the Crohn's. The gastroenterologist put me on tons of different medications, like millions. I can't even remember all of them. But by then it was too late. And that's, a few months later I had the surgery to remove my intestines. So at that point, it wasn't called a flare-up because a flare-up is where you are affected with the disease, you kind of go in remission, and then it comes back. So that was just the initial disease. Starting point, basically, was when I was 16 and I had that. So yeah, the diagnosis is a long process. That is a very common thing with Crohn's, is you can be misdiagnosed a lot because there are different symptoms for different people. Not everyone is the same when it comes to symptoms, and it kind of comes on gradually, and so they might not know what it is at first. So, yeah. As far as when it's diagnosed, usually in your teenage years. That's usually when it's diagnosed. Anywhere from the teens to the early 20s is when it's diagnosed, when it starts happening. A lot of people can go in remission where they don't feel the effects for years. I really haven't had a lot of issues for a while. I'm pretty lucky. Off and on I have little flare-ups, but it's not nearly as bad as it could be. So I'm pretty lucky as far as that goes. It's basically a type of an autoimmune disease. So basically the autoimmune disease targets your digestive system. Can be anywhere from your mouth to your rectum, any parts. Most of the time it's your intestines. So it's called an inflammatory bowel disease. And so for me, the area that my body targets to cause the disease is the junction between my small and large intestine. So basically what happens with the disease is it causes inflammation, and because of the inflammation you have lots of symptoms like pain, cramping, diarrhea, weight loss, malnutrition. You don't absorb nutrients very well because of the inflammation in the intestinal wall, things like that. So eventually you usually are on lots of pretty harsh medications. I had surgery to remove part of my intestines about 10 years ago. That can happen as well. It can get so severe that you have to basically have all your intestines removed and get put on a colostomy bag for the rest of your life. So it can be not fun, but I've learned recently some different ways to deal with it that does not include medication, so it's pretty exciting actually. From my research, it's been a while, but I do believe in like North America, the United States and those areas, it is more common than other areas of the world. I do not know the prevalence, and as far as what causes it, they're pretty unsure. They do think it can be hereditary. I'm not sure if I agree, but they do think that. One new portion of research that has just come out, well, maybe not that new, but is that the disease has to do with certain types of bacteria in the digestive system that cause the inflammation. And so they have limited it down to 2 types that if seen in your, when they take samples, they can pretty much turn things around when they can get rid of those 2 types of pathogenic bacteria in your gut. So that is one cause they think it might be from bacteria. So yeah. One thing that I haven't really touched on is the effect psychologically Crohn's disease can have. It can, well, when the disease is pretty progressed, it can also make you pretty depressed. And that is due to the physical changes and physical imbalances due to Crohn's. So because you're malnourished, you do not have those vitamins and nutrients, they're not being absorbed through your food, that affects your brain pretty intensely. So during that time where things were pretty severe when I was 16, before my surgery, you're pretty sad all the time. You're not very happy, and that's pretty common with malnutrition. And another aspect of Crohn's that I haven't really talked about is exercise definitely helps. I need to do much better about that, but just like with any disease, exercise helps. So that is another thing that I've seen has really helped me. When I am good about it, I feel a lot better. But I guess that's with everything. So as far as the symptoms go, nausea is often one of them, so you can be prescribed nausea medication. I haven't for a long time, so I don't know what it's called, but basically what happens in the beginning is fatigue. You get really tired all the time, you don't know why. The diarrhea symptoms, multiple times a day, things just run through you. And then eventually the pain, abdominal pain for me, pretty severe, so severe that in high school I had to stop going to school because it was so painful. I had to I wasn't on pain medication until close to the time of my surgery. I just kind of dealt with it. But eventually things become so inflamed that it starts producing scar tissue. So that starts closing a section of the intestines. So think of it as a round tube. It starts getting scarred along the walls. So it gets smaller and smaller and smaller, so that eventually it becomes completely blocked. And so that's called a blockage. And that is where most of the pain comes from, because things can't get through. There's something called a peristaltic contraction, which is that's how your food gets through the intestines. Your body just contracts and it just flows through naturally. And during each one of those contractions, kind of like labor, similar to labor, I just went through that, so I can say that, it's stopped. That contraction is stopped, and everything, all the food, everything is stopped in its place, and that causes a lot of pain. Which eventually turns to distension. You see someone who is really skinny, and their stomach is, pretty distended, pretty out there, and that's because of the blockage. And so if they can't get things to turn around, they have to do surgery to remove that blocked and scarred and inflamed section of your intestines. And so that's what I did. They took me to Primary Children's, which is a great hospital, and performed surgery, and it was about 13 inches of my intestines that they removed. Things went great. They used laser, so I don't have a large scar at all. I just have multiple small incisions. And since then, I have not had any more surgeries, and I have been able to control things better with diet, which I didn't know about before. So one of the main treatments is an immunosuppressant drug, because it's your immune system, or at least I think, some people think it's your immune system attacking itself. They can put you on immunosuppressants, so it suppresses the immune system. So theoretically, they think it would help with the symptoms in that way. So I'm actually on an immunosuppressant called azathioprine right now, and I have been for the last 10 years. And there are also medications that are injections, or they can be intravenously done monthly or things like that at an outpatient center. Those are called biologics. I've been on a couple of those before, Humira and Remicade. Those are used, again, to control some of the process in the body that turn your body against itself. Those medications are also used for things like rheumatoid arthritis, other autoimmune conditions, things like that. That's definitely a concern I had whether I would even be able to have children once I was diagnosed with Crohn's disease. And it is very common that during pregnancy, your disease kind of goes dormant. It kind of goes in remission and you feel great. Because in general, when most people are pregnant, their body focuses on growing that baby and supporting the baby, and it kind of pushes everything else aside. And so that was a definite benefit for me. I felt great. My doctors wanted me to stay on the immunosuppressant just in case. They didn't want me to all of a sudden go off it and have my body kind of go into freak out mode while I had the baby. And so they decided the benefit outweighed the risk of staying on, because it is not technically supposed to be used during pregnancy. But luckily there were no problems. It's a very low risk, but still, ideally you wouldn't want to take that risk. So my doctors decided that I would just stay on it and then see how it goes afterwards with tapering off. It is also very common that after you have the baby that you have a flare-up, which is where your body kind of, the disease goes into hyper mode and starts attacking things pretty strongly. And so I was a little bit worried about that. And so I really tried to, while I was pregnant, to make meals that were good for me to eat, so that after I wouldn't resort to those really bad foods like pizza every day, because I was just short on time because of a newborn, And so I really tried to make a lot of freezer meals. I tried to be prepared, and I tried to have the people around me support me in that and try and help me stay focused on my diet so that I wouldn't have a huge flare-up. Also, this other medication that I was put on shortly after I had my baby, I was put on it about 2 weeks after the low dose naltrexone, I believe has really helped me not have that flare-up because I haven't had one. And so that is a pretty big blessing for me. So that is pretty common, to have remission during pregnancy and a flare-up after pregnancy. It's very common. As far as the ability to get pregnant, we were trying for a long time, and I wasn't sure if I was going to be able to. But this doctor who is specialized in autoimmune conditions, he helped me find out that my thyroid was also off. And he believes it is kind of all related, that the autoimmune condition can kind of make things everywhere kind of off a little bit. So he fixed that and put me on some thyroid medications to get it all in balance. And soon after, I got pregnant. Because your thyroid regulates a lot of things, including your ability to become pregnant. Not always, but it's very important in sustaining the pregnancy as well. And so I really believe that's why I got pregnant so easily after I was put on that medication and the thyroid, which is pretty much the one of the biggest, the main control of everything in your body, your hormones, everything. I really believe that's what helped me. And so because of Crohn's, so as far as during pregnancy, I was worried that I would have a flare-up, because obviously if you were to have a flare-up, it would also affect the baby, and negatively possibly. And luckily that did not happen, but that is why you want to be careful with your diet, especially during that time. Make sure you're maintaining a healthy diet, of course, to support the pregnancy as well, but to make sure your body doesn't go into flare-up mode. And also, you don't want to make any major changes with medications during that time. Especially if you've been on them a long time, your body can definitely react to a big change like that. So that's why they ended up keeping me on my medications. So, yeah. As far as the different types of surgeries, I'm actually from Idaho Falls, and when things were happening and I was in so much pain that they needed to perform this surgery, all of the great surgeons were out of town. And so one of the old-fashioned techniques to do this surgery is to do a pretty large incision from pretty much here to here. It's, pretty much cut you open completely. And obviously that would be a much longer recovery time. And so I chose to hold it out and head over to Primary Children's as fast as we could. And so we could do it with lasers. So they can only do, it's just a tiny multiple incisions, and they balloon the stomach cavity open, I'm not exactly sure, so that they can do it that way. So it's a lot faster recovery time. Basically, after the surgery, you can't eat solid food for like a week. That was hard. So they put you first, you can only have water, and they have, you on IVs. The next couple days you have, clear liquids, things like that, or just liquids, broth, things like that. And then eventually, I think it was after about 5 days, I could start eating soft foods. As far as pain goes, they have you on some pretty heavy pain meds, which I stopped using after just a couple days because that kind of made me sick, which happens a lot. So I could not get up by myself. You can't use any of these muscles, so you have to have help to and from the bathroom, to and from anywhere for a couple weeks. Once I was discharged and went home, same thing, I decided to pretty much relax in bed for a few weeks, and my mom would have to help me up out of bed to get to and from places. So I felt a million times better after surgery, even with all of that, because of the amount of pain I was in before. So I guess that once they've removed, pretty much all of your intestines, there's really nothing left. And so basically you can't go to the bathroom anymore. It doesn't exit out the way it should. And so they have to, because there's really no connection anymore, they can only connect it so far. Obviously that is pretty extreme. You have to have many surgeries for that to happen, because there is a lot of intestines. There's feet and feet of intestines. So it's an exterior bag that they hook on, I would assume, somewhere at the end of the stomach where it meets the used to be intestines, and exteriorly you have this bag where the waste goes. Miserable. I never want to get to that point. So that's my goal, to not get to that point. So before I knew about certain things like the probiotics and the diet and things, before that, when my intestines were already kind of damaged because of the foods I had eaten and because of the inflammation, actually healthy food and fibrous foods were the things that I avoided, because they would cause blockages pretty quickly. Because my intestines were already damaged and the inflammation was already there, those things were not absorbed well, and my stomach could not digest them very well and couldn't break it down. But now I know it's because my intestines were already previously damaged because of the unhealthy food. Now that my intestines are more, they're healed and they're more stable, healthy food is what keeps things going well. And now I can digest it. Before, I stayed away from salad, I stayed away from broccoli, I stayed away from anything that wasn't cooked, that wasn't, any vegetables that weren't cooked. I had to stay away from most healthy foods. I had to stay away from popcorn. Any corn was a bad one. Things like that really were hard for me to digest. But now that I know that that's not actually what was causing the problem, that was just a byproduct of the problem to begin with, that just kind of compounded. Once things are unhealthy and messed up, then you can't really eat those things. You kind of have to, basically there's this diet called the SCD diet. It's called the specific carbohydrate diet. It's a doctor who has come up with the theory that certain types of foods, those pathogenic bacteria, feed off those types of foods in your digestive system, and that kind of contributes to them living. If you cut out those foods, they don't really have a food source, and so then your microbiome and your gut gets back to healthy. So the main foods on that list are starchy foods, which I haven't been doing that great with lately. I like white potatoes, sugar, a lot of processed sugars. Gluten is one of them, sadly. Just more of the processed breads, things like that. Just processed food in general, basically. Corn is one of them. That's an inflammatory food. Dairy, a lot of dairy. Basically, you have to start out on this diet by cutting out those foods so that things can heal and so that the bacteria can get back into more of a balance. And then eventually, you can start adding things back in, but you want to make sure to maintain an overall healthy diet. So, as far as the one I've been on the longest, the azathioprine, the immunosuppressant, I've been on it so long, I'm not really sure if I'm biased or not, but I don't have many side effects. It is supposed to suppress your immune system, so theoretically you're supposed to get sick more often because it, suppresses your immune system response to everything else that you come into contact to. I really don't get sick very often with, flus, things like that. So I would consider myself lucky, but that is a common side effect, just not for me. The biologic medications, though, I did see pretty bad side effects. The one I was first on before I had surgery when I was 16 is called Remicade, and that's where you go to an outpatient center where you just sit in a chair and they put an IV in and run the medication through you for about an hour. You just relax. And that's, I think, once or twice a month that you do that. And that's more heavy-duty medication. It has more side effects. I think that one of them is cancer. So it's more on the risky side. And that can definitely make you more sick. And that did make me more sick. I would kind of catch everything when I was on that. I wasn't on it very long because it was kind of too late and I had surgery pretty soon after. About a year and a half ago, my gastro doctor put me on another biologic medication because he had done a routine colonoscopy. You have to have those about once a year, just to check and make sure things are doing okay. And he saw things he wasn't really pleased with, and so he wanted me to go on that biologic called Humira. And that's an injection that you inject yourself with at home. I can't remember how often it was. I think it was once a week for a while, and then it was every other week, and then once a month. It kind of ramped up in dosage. That made me sick a lot too. It gave me a lot of side effects. I was really sick. I caught everything. I caught the sinus infections. I caught the flu. I caught all these things that were going around at the time, which normally I don't. And it also gave me really, really bad acne, which is weird. But it is a side effect on the medication side effects. It is a known side effect. It was all over. It was horrible. And finally I figured it out. And it didn't seem to be helping me feel any better or helping any of my Crohn's symptoms. So I decided to stop using it. So I'm not on that anymore. I'm actually on a different medication that's called low-dose Naltrexone. I don't know if it's newer, but it is newer in the use to control Crohn's disease, in that it controls, I can't remember, I think it's T cells. They're the type of cells that, I'm not quite sure, I should know this, but they're the type of cells that control the body's reaction to certain things. So what low-dose Naltrexone does is it helps the body know when to stop attacking itself or causing the inflammation. It kind of helps control that response to kind of tone it down, because that's another idea that Crohn's might be your body doesn't quite have the right balance of when to react and when to kind of tone it down. So there's different cells in the body that always build things up or tear things down, and they think it might be kind of out of whack. So that has been helping me. I've only been on that about 3 months, and my doctor wants to slowly cut down on my azathioprine dosage in about a month, kind of taper that down, because that is also not the greatest medication to be on long term. It can cause cancer and other things like that. So ideally, I would rather not be on that. So, since I have a baby, azathioprine isn't the best medication to be on when nursing or when pregnant, things like that. And so they want, for my next babies, hopefully for me not to have to be on that. So the blockage can get, the intestinal wall can become so stretched in that portion where it's blocked that it can burst and it can spill out into your abdominal cavity. That is pretty scary, and I was this close to having that happen. That's why they actually wanted to life flight me to primary children's, because they were so concerned about how close it was to that point. But I refused, so I just rode in the car. So it's only 3.5 hours, no big deal. But yes, once it gets to a point, yes, it can become so thin and so distended that it can burst. I'm not exactly sure what happens at that point. I'm sure they just have to go in and do an emergency surgery and clean things out and try and do something. I'm not sure exactly what would have happened. I'm sure that would have made it even harder to repair, I would assume, to repair the intestines and connect them together once they remove the diseased portion. I would assume that would make it even more difficult. But as far as that happening, I don't know how common that is, but I know that most Crohn's patients have, I think it was at least 2 surgeries in their lifetime. So that is pretty common to have surgery. So I've already had one, so I don't want to have another anytime soon, because then you're that much closer to the colostomy bag, which is the goal of all of us to not have. So, but yeah, sadly, and it almost was to my detriment, but I have a pretty high pain tolerance, and so I was just trying to deal with the pain up until that point where it was so distended and so painful. And that's why I was so close to having it burst, because I could deal with the pain. So that's not smart to do. Just make sure, I saw enough doctors and they were trying to hold out for that not to happen, for me not to have surgery, but it was too late, and it was a better thing in the end to get things on a healthy note and start new. So I've had many more small blockages that go away over the years. That one was just so severe that there was no turning back. There was no healing it. It was done. But there's different foods that some people get blockages more easily from. What I've more recently learned is that because of the food you eat, it can cause the inflammation in your intestines, which is why there becomes this imbalance of the pathogenic bacteria that are seen in Crohn's. So that's what I've recently learned is when you eat foods like processed foods, unhealthy foods, for people with Crohn's, it causes these bad bacteria in the gut to increase, and those in turn, what they do is cause inflammation. And so in order to switch things around, it's really important to be on a good probiotic. That is a huge thing that I wish I had known a long time ago. So I always take a probiotic. I always try and eat, probiotic rich foods like plain Greek yogurt, pickles, all those types of fermented type foods that really can help balance the stomach bacteria again. Also, making sure your diet does not consist of those processed foods and bad foods that cause the inflammation in the first place can really turn things around. So recently I learned that, and a little bit after my Crohn's gastro doctor did the colonoscopy, that was about 2 years ago actually, and put me on those injections again, and he said that was in October of 2 years ago. He said that if things don't turn around, we might have to have surgery again that following summer. And that obviously made me worried because I'm young and I don't want to have 2 surgeries by the time I'm, 25. And so I started doing some more research into more natural ways of healing Crohn's or dealing with it, treating it. And it led me to this other doctor. He's a doctor. He's not a gastroenterologist, but he's just a MD. And he specializes in autoimmune conditions and a more natural way of dealing with it. And so he's the one who put me on the low-dose naltrexone medication, and he's the one who's been helping me with my vitamin deficiencies, dealing with that, putting me on the probiotic, and testing my stool samples to see what types of bacteria are in it, and there were the bad types of bacteria in it. And so he's not for antibiotics because that can wipe out all the good bacteria, so that can cause more problems with Crohn's disease. But to get rid of those pathogenic types of bacteria, he put me on a very specific type of antibiotic to target those. And since then, I've been doing really well. So I haven't been doing amazing lately with my diet, being a new mom, but I really try hard to eat, basically just eat healthier. I honestly believe that eating healthier, following the word of wisdom, eating fresh fruit, fresh vegetables, eating things in season, eating just a lot less canned foods, a lot less boxed, processed foods can help any disease. That's what I really believe. And it makes sense. It just makes sense that it would. So that in of itself has made it so I didn't have to have surgery. And my gastroenterologist said I wasn't going to be able to sustain a pregnancy. I had a great pregnancy. It was amazing. And my little boy is healthy as can be. So I'm really grateful to have that knowledge so that I can live my life and be healthy and be able to support my family. So it's pretty great. Definitely helping them do research. I am definitely open to new ideas, new research. There's always things coming out, new information with this disease. There's really not a whole lot that they know about it. And so I'm always open to people giving suggestions or things that they've heard or learned research-wise, or stumbled upon in their readings. I'm always open to that. I'm open to people, just positive people around you. That definitely helps you, especially when you're feeling pretty sick. It's definitely a pretty big trial when you're sick, but it helps you realize how good your life is when you can compare those times that were really hard. You can kind of realize how much you're thankful for, and it really helps keep you humble, and it helps keep you keeping an eternal perspective. That's always, I'm actually grateful for the disease because we as humans can easily go through that pride cycle where we forget our blessings and we can forget all of the things that we should be grateful for. But the Crohn's kind of helps keep me in check when I'm sick. I realize, hey, I have a lot to be grateful for. I'm grateful for my family. I'm grateful to be healthy. I'm grateful to just be able to walk around and function like a normal human being when I am. And so it's definitely something that I am grateful for, so that it keeps me in check. So I know a little bit about ulcerative colitis. Basically, and I don't know a whole lot, but it is very similar to Crohn's, but it affects a different part of the body. So ulcerative colitis is from what I know, it usually attacks a little bit higher up in the digestive system, so more towards the stomach, but I could be wrong. And ulcers is a big problem. That's what causes the pain. That's what causes the walls of the digestive system to become unable to absorb the nutrients. So similar to the way Crohn's does with the inflammation in the scar tissue, the ulcers cause a lot of problems. So a lot of people with ulcerative colitis have the same exact success with the whole diet thing and the bacteria balancing ideas as people with Crohn's. So a lot of the same treatments naturally apply to ulcerative colitis. So they're very similar as far as symptoms and severity. Each one of them, ulcerative colitis and Crohn's disease, both have different levels of how severe your disease is. And you can have a very mild form of Crohn's, you can have a very mild form of ulcerative colitis. Same with severe. I've seen people who have very severe forms of ulcerative colitis. They almost die. They have to receive blood transfusions. They're so sick. It can get very severe with both diseases. And the symptoms are very, very similar. It's just kind of, I'm not exactly sure how they diagnose the difference. I'm sure it's just the location and what it kind of looks like when they see it, when they actually go in and look with scopes and things like that. So just inflamed and cause pain, and it causes that layer to become thinned and really painful. So as far as I know. And it can cause blockages, it can cause the malnutrition, it can cause the diarrhea, it can cause pretty much all the same symptoms as Crohn's. So from what I've learned recently, it definitely can, and it can definitely cause autoimmune symptoms. I'm sure you've heard a lot of people who complain of joint pain, stomach issues, just, bathroom issues, things like that, and that's pretty common. I bet, there's a lot of people I know who are dealing with those things. And that is simply because of what they eat is causing, like you said, an imbalance of bacteria and causing inflammation to spread throughout the body. And so it's replicating autoimmune type symptoms, which is the joint pain, the bathroom issues, the stomach pain, things like that. So that's one theory. That's obviously not anything widely accepted in the medical world, but it is pretty widely accepted as far as a lot of Crohn's patients have been having a lot of success with these new ideas.